Hello, podcast listeners. Welcome to a special episode of the Voice of San Diego podcast. San Diego is in the middle of a hepatitis A crisis. The disease is rare and often only seen in third world countries. So how did we get here? How did this happen? I'm Kinsey Moreland, and I'm here with Lisa Halverstadt, Voice of San Diego's reporter who's been covering the Hep A outbreak as it unfolds. Thanks for being here, Lisa.
Thanks for having me.
So, Lisa, more than 500 San Diegans have come down with hepatitis A, but it feels like we only heard about it recently. Why is that?
Well, until about a month or two ago, we weren't really hearing a lot about it. Politicians weren't talking about it, and there wasn't really a sense of urgency to deal with it. There was some work happening behind the scenes, but most of what we were hearing is that this is really confined to two main populations, and that is folks who are homeless or illicit drug users. And so I think even the initial stories that came out about it, a lot of folks dismissed because they thought that's a pretty small group of people.
Right. So when did they realize that it was bigger than that? When did they realize that this is a crisis?
Well, the county first declared that there was an outbreak in March. They had seen just over double the number of cases that they normally would have seen between November and early March. And so they did declare an outbreak at that time. And I should note, too, that this is something that, they would have a few cases a month most of the time. Mm-hmm. It's really, obviously catapulted quite beyond that. Now we have more than 500 cases countywide. But first, at the beginning, this wasn't really seen as a crisis back in March. The county really pushed for more vaccinations. They started talking to nonprofits that work with homeless people and drug users, but there wasn't really an alarm being sounded right off the top there.
So what were they doing right then? Just talking about it and just thinking about it, or just monitoring it?
Well, there certainly was a lot of discussion about increasing vaccines. The county early on determined that vaccines were absolutely the best way to try to approach and combat this. One of the challenges, which I'm sure we'll talk about a little later, is that this population maybe has a little more trouble getting access to vaccines and is more vulnerable.
So you did a really interesting story for Voice of San Diego, sort of laying out what was happening between March and May. What were county officials saying then?
Well, at that point, like I said, they were really focused on vaccines, and there seemed to just be this sense, and there's some dispute and finger pointing about this, but among folks on the city sides that the county's got this. The county has this handled.
Okay.
And so a lot of the emails going back and forth, there'd be, questions, but it was kind of a bureaucratic, friendly response, not really a, oh my God, we need to do something sort of discussion.
So what made addressing hepatitis A outbreaks so difficult in those early stages? Like, what was so particularly hard about it?
Well, just the population that's most at risk here. The homeless population, by its nature, sadly doesn't have the same access to sanitation and restrooms that the rest of us are so lucky to have. We don't realize that, how much of a health issue it just allows us to prevent dealing with, that we can wash our hands easily. Then the county did realize, this is going to be difficult to combat it if we don't, make it easier for folks to both get the vaccines and have access to sanitation. So they did start having teams go out to give vaccines at homeless camps, but there was still some resistance because this is a population that, has some issues sometimes with authority and questions whether folks really want to help them. And so then you had this other issue of just the lack of sanitation. So if someone's not going to get the vaccine or they haven't been touched in that way yet, what are they going to do to prevent the spread? And so some of those sanitation steps have been a more recent movement.
So we should note here that how hepatitis A spreads. It's the oral fecal, if there's trace amounts of fecal matter on a door handle, for instance, and then you touch that and touch your mouth without washing your hands. So that's why hand washing became so important. More recently, we've seen these dozens of hand washing stations go up all around the county. There's people power washing the sidewalks in some areas. When did the city of San Diego and the county first start looking at these?
Well, there's some dispute about that. So the county says that they first brought this up with the city of San Diego back in May. The city says, no, there really weren't any specifics offered. So we didn't really know what to do. We were waiting on the county. Regardless, by early August, there were still only 2 hand washing stations outside a county building. So there was some sort of roadblock there keeping this from really moving forward. Now, when the county initially talked about it publicly, they talked about it as a pilot. But at this point in early August, we had multiple deaths. We had hundreds of cases at that point, I believe. And for some reason, there really wasn't a quick deployment of these hand washing stations. So I met with the county and the city actually together in mid-August, and we talked about, what was the holdup with the hand washing stations. And there was some discussion at that time about permits and, bureaucratic steps that needed to be taken. Well, that all changed. In late August, Kelly Davis, who's a Voice of San Diego contributor, published a story in The Guardian kind of touching on this issue of the hand washing stations. And I published a story for Voice of San Diego on August 30th, just kind of laying out this sort of bureaucratic finger pointing that was happening over the hand washing stations. And, I'm not somebody that likes to take credit for things, but the one thing I can say is the day after that, the county issued a directive to the city detailing that they wanted 30 hand washing stations at least to go up all over the city. And they also gave a more official directive to the city to come up with a plan for sanitation, cleaning of streets and sidewalks. And quickly after that, by the end of that weekend, there were actually more than 40 or so hand washing stations that had gone up around the city. So something changed at that moment and it really kicked off a lot more activity.
And so other than the hand washing stations and the power washing, what else has happened since then?
Well, political leaders are a lot more engaged now. The mayor in particular has announced a lot of different new plans. There's now plans for 3 new shelter tents. A sanctioned city campground has opened up. Safe parking has been expanded for people who live in their cars. And this was not something that was city supported or sanctioned before. And on the county side, they're now up to 84,000 vaccinations. And at the time that the action sort of began on this, that really became more dramatic, they were just at 19,000. So it's pretty dramatic, the steps that have been taken.
Yeah, and it's cities all across the region are starting to kind of get in the action and implementing similar policies. So this is happening in places other than just the city of San Diego, right?
Yes, the county's been having meetings. In particular, El Cajon has really stepped up and taken some big steps to try to address this because they're another large hub of this.
Right. So do we have any sense that we're at a point where this is going to slow down?
So we're not really sure. So one of the points that has made this challenging to track throughout is that there's a long incubation period associated with hepatitis A. It can take somewhere between 2 and 7 weeks sometimes before someone really realizes they have it or, maybe, is really still potentially going to pass it along to someone else as well.
Right.
And so while county officials are starting to see that maybe there's a lower number of cases coming in per week, that incubation period really complicates matters.
So what are the latest stats? Where are we at with numbers right now?
So this past week, the county said that there are now 516 cases, and those are those that they've confirmed. They have another 40 that are under review right now. There have been 19 deaths, and more than 350 people have been hospitalized.
Wow. So about those 516 cases, we've heard a lot, as you mentioned at the beginning of the show, about how homeless people and illicit drug users have been hit the hardest. But that's kind of a misconception. That's not the only community being affected. Is that right?
Yes. So about 27% of the cases have been among people who are not homeless or illicit drug users. At this point, the total there is at least 138 people. And the counties really, initially didn't have a lot of information about this group of people, but this past week we did get a little bit more information. The county said that about half of the folks that are not homeless or illicit drug users have had some sort of direct contact, whether they shared a kitchen or a restroom. But there was a new piece of information this week that struck me. About half do not have direct known contact.
Wow. So let's listen to a clip from Ed Blitz. You wrote about him in one of your pieces and did a video for our website, voicessandiego.org. And he is a Bankers Hill resident who was infected with Hep A.
My wife and I went to this little seminar, And she turns around and looks at me and goes, "You are yellow. You are all yellow. We are going to the emergency room right now." So we went to the emergency room, and they immediately gave me a blood test and came back and said, "You got hepatitis." What drove me crazy was that everything I did read kept saying homeless, homeless, homeless. And I'm sitting here going, I ain't homeless, you know, and I got it. And then I start reading, well, 30% are not homeless. And I'm going, there's no publicity about this. I mean, it's all homeless, homeless, homeless. And it's bad, believe me, but, you know, there's another 30% here that are being affected by this.
So, Lisa, what do we know about people like Ed? You already said, you know, there's about half that have not come into direct contact with homeless people. So how are they getting Hep A?
Well, not that we know of. That's the key. And there's a lot that we really don't know. I mean, what the county's doing is they're going out and doing interviews with folks or trying to gather more information. Right. But it's really hard to track. Where was somebody for those 2 to 7 weeks necessarily? What might they have come into contact with? Could they have gone to a restroom in Balboa Park where somebody didn't maybe wash their hands properly? Could they have, you know, had a cup at a restaurant after someone who, you know, maybe the cup wasn't properly cleaned? It's just really hard for us to know. But I can promise you I'll continue pressing on it to get more information.
Well, it's hard because, you know, I'm a parent of young kids, and we deal with a lot of similar diseases that travel that same way, the oral fecal, and it's gross to think about, but it's like you always play this game of like, okay, so I have the stomach flu, he got the stomach flu, which one of my friends gave us? And it's I mean, it's futile. It's very difficult because of that incubation. You know, your kid can be well for 2 weeks, and yet the virus is still alive in their stomach, and then they pass it on to, you know, your best friend's kid. And then, so yeah, I mean, I just see the difficulty in tracing something like that. It's almost impossible.
And that's a really good point, and reminds me of something that I want to emphasize to parents out there, because there is a lot of fear. Certainly, I mean, all of us know kids pick up stuff all the time.
But put it right in their mouths.
Right in their mouths. But in this case, what the experts have told us is that most children are vaccinated for this really early in life. And so kids are not necessarily most vulnerable to this. There's actually only been one case of a child, a 5-year-old. And in this case, that child's family had an opposition to vaccines.
Oh, interesting. Okay. Yeah, that's something that I was glad to listen or watch the video you and Adriana made. It's a myth-busting video. It's amazing. And I went and got the Hep A vaccination because I realized that I'm in that older age group that was, you know, didn't get it because I was, you know, outside of that window when they started giving Hep A vaccines. So, Lisa, I wanted to play another clip. And this one's from Michael McConnell. He's a local homeless advocate who's been in the spotlight during this outbreak. He wrote an op-ed for us recently and called out the city and the county for its ineffective homeless policies. And here he is at the Regional Task Force on the Homeless board meeting in September.
To the local media who actually broke the story and raised the level of this crisis while our city and county leadership had their head in the sand. It was so crucial, and I want to thank the local and the national media who really raised the awareness on this when others weren't, and I'm sure that helped to save lives. I want to thank the other heroes in this, and that is the people on the street, the nurses, the police homeless outreach team, the providers who are doing what they can, all those people who want to do and save lives regardless of whether they get the support from the leadership. That is really impressive. We will move forward as a community no matter what. It's the leadership that needs to catch up with what the community wants to do. And it's not just on the hepatitis, it's just on homelessness in general too. So thanks again for all the people who are on the ground making this work, and the media for actually raising the level of awareness on this and actually doing the job of our elected leaders who should have been doing that much, much earlier on. I'm not going to harp on that. It's well documented where the ball has been dropped. There's 100 media stories out all across the country. I just got a call. There's more national media hitting the ground here tomorrow. It's everybody's well aware of this crisis. It's spreading all around the country now, as we've heard, this strain of virus. Maybe some of that could have been stopped with earlier action.
So, Lisa, obviously there are a lot of people who agree with Michael and are really angry that more wasn't done earlier to prevent the Hep A outbreak. But, it's sort of, we can't do anything about that now. So what's happening right now? And are city and county leaders finally doing enough?
Well, there's certainly lots of coordination on this issue now. I'm hearing that the city and county officials are in touch daily, and I'm mostly hearing good feedback even from some of your advocate types. But one of the issues that I think that this really kind of puts the focus on is just how much San Diego's homelessness crisis can put us at risk for other crises, in this case, a health crisis. And so there is also a lot more discussion about homelessness, and we've seen the mayor come forward with some different ideas, but those are short-term ideas. So a tent, multiple tents, a safe zone. So I'll really be looking to see what are the long-term solutions to this problem to make sure that we don't have a crisis like this again. And we're getting some of these folks that are on the street who are so vulnerable to diseases like this into some sort of permanent solution, a home. And so that's the question I'll certainly be, watching and asking as often as possible in coming months here.
So I just wanted to play another clip. This is Mayor Kevin Faulconer at a press conference in September. And I think you can hear in his voice how, he is saying he's committed and very serious about this.
There are lives at stake. Every person affected has a family, has friends. This is personal. This is our community, and we will protect it. And I want San Diegans to know that the county has their top medical professionals working on this, many of who you see standing here behind me today. Medical, county, and city officials are in constant communications with each other. There's a plan of action, and we continue to work together to battle this outbreak.
So we've obviously heard a lot about what the city's doing.
Right.
So let's maybe give a quick update on what the county's doing. So the county had declared a state of emergency at the start of September, and they've really been stepping up and redoubling their vaccination efforts since that time too. So as I said earlier, they're up now to about 84,000 vaccinations, huge number of vaccinations. They've had public health nurses and others going out to help with that. And Ron Roberts, who's a county supervisor who's really kind of taken the lead on a lot of homelessness issues and on this hepatitis A crisis, has had meetings with folks with the CDC, the Centers for Disease Control and Prevention, in Atlanta and DC, and certainly has also been having a lot of meetings with other folks here locally on that issue.
Mm-hmm. So here he is, actually, County Supervisor Ron Roberts at a press conference in September.
We have people who are working around the clock and have been on this. More needs to be done, and we're ready to do that.
So, Lisa, I just wanted to ask you, as a reporter, you've been on the hepatitis A beat for months now. Like, how is that impacting you? How do you feel?
Well, I got the vaccine early on.
Good.
So there's that. I think it just generally puts into focus for me just the tragedy of life on the street. And people who are homeless are so vulnerable to so many things. And in this case, it's a public health crisis. But just in general, enforcement that's been up in the wake of some of these hepatitis A steps has really, affected a lot of folks' lives too. And of course, there are people that believe that enforcement is necessary and facilitates the cleaning, but it does upend lives. Right. There are people that are affected by this. And I guess, if there's one point that I like to make every chance I get, and it's just, I guess also that just imagine everywhere you go, somebody is telling you to move on and that you're not wanted. That's something that is just a visceral thing that I hear from so many people who are homeless. And I think what this crisis really doubles down on is we have a crisis here and we can't look away from it.
All right. Well, thank you so much for talking with me.
Thanks for having me.
podcast listeners, please join Voice of San Diego for our next member event, the rescheduled Brews and News member mix-up at 5:30 p.m. Thursday, November 9th at the Museum of Man in Balboa Park. Voice of San Diego and the Museum of Man are teaming up for an evening of civic affairs, exploring the human experience, and, of course, beer. This free event is only open to Voice of San Diego and Museum of Man members, so if you're not a member already, become one today. Events like these are just one of our member benefits. To learn more, go to voiceofsandiego.org/membership for more information.
Hey, welcome back to this special episode of the Voice of San Diego podcast. I'm Kinsey Moreland, and I want to start by playing a clip from a new documentary called Tony the Movie.
We're probably going to jail today. Yes, sir. It's just not enough time to fix a 58-year-old man's broken life in 45 days. It's not going to happen.
Do you have planned activities other than just surviving that make you feel happy and fulfilled?
No. They're on you here. They're on you.
All right. I'm joined in the beautiful Voice of San Diego podcast studio by Dennis Stein. He's the director of that documentary you just heard. And Tony Rodriguez, who's the central focus of the film. Thanks for being here, guys.
Thank you so much.
You're welcome.
So, Dennis, can you just start by explaining the film? What will people see when they watch it?
So really, you'll learn about Tony's life living on the streets here in San Diego. And then you'll also learn about him trying to get housing and kind of the system that he goes through that San Diego has him go through to try to get housing. And then you'll see him talking to local folks about, what are we doing to address homelessness and how can we do it better? And then you'll see him go to other regions and kind of study what they're doing, especially Houston, and see how they've made a lot of progress. Houston is like the largest metropolitan area in the United States to have significantly reduced homelessness. And he got to meet with 9 or 10 people there. Then he comes back, sees what's going on here, some of the changes that have happened in the last year, and ends on a high note, I think.
All right. And so, Dennis, you're sort of man about town. But people know you as more of a business guy or maybe even a skateboarder. You've done some advocacy work in the skateboard park realm. What made you want to make a movie, and how did you meet Tony?
Well, I made skateboard videos growing up in the 90s and had a VHS camera. And, after doing that I had a career in videography by the time I was 19, and I was just tired of looking at life through a 1x1 inch black and white screen. Sold everything. 25 years later, I owned Sea Rocket Bistro in North Park and wanted to make some videos about our vendors. Picked up the camera, made some videos. Also I owned some UPS stores in San Diego, made some training videos for the UPS stores. And then I went up to Seattle, visited my brother and discovered that he had a Canon DSLR 6D full frame camera, beautiful lens, and we made a little skateboard video. And I was like, wow, the quality of this is spectacular given the price of the camera. So much better than when I was making things in the past. And then I just wanted to really make a more important video. And I asked a friend, I'm like, hey, what topic is really important and could use some more focus and is misunderstood? And the topic of homelessness was the one in San Diego. And so I decided to go down to 17th Street and see if I could interview some folks who were homeless. And I wasn't really sure where I was going with it. I wanted to make a documentary, but I didn't know what the story would end up being and how it would be approached. And I went with the Alpha Project Outreach folks. We paid people $10 each to go on camera for 5 minutes and talk. And Tony, somebody walked around the corner and found you and said, hey, there's $10 over here. You want to come be on camera?
That's true.
So, Tony, are you comfortable in that space? What was that like, having him following you around?
Oh, it wasn't hard for me. No, it was easy. It was hard showing up on time and being ready, and
right.
That's hard. But yeah.
So anyway, I found him on 17th Street, and a lot of the other folks were hard to contact again. Homeless people are sometimes difficult to find, and their phones don't work, or they don't have another way of they don't check their email because it's hard to find places to do that. And so I was riding my bike from North Park, where I live, down to the beautiful Voice of San Diego offices on November 4th to see the presidential election.
Oh, hey, I didn't know we played a part in this.
Yes, and I bumped into Tony on 15th Street as I was riding my bike. He was riding one way, I was riding the other. Said, hey, Tony, I've been looking for somebody to follow around. Can I follow you around tomorrow? I met him at 6 a.m. on November 5th and told him Trump was president. He was surprised.
Discouraged.
And then started following his days and discovered that I needed to take the story towards the solutions.
Yeah, so Tony, even just that short clip that we played at the beginning, it's about enforcement and being, sort of hassled by the police a lot. So homeless enforcement is up downtown. How has that affected things for you and your girlfriend, Ginger, who, by the way, wrote an amazingly powerful op-ed for us? And it's you can read it on the Voice of San Diego website. So, yeah, how is that increase in enforcement affecting you?
Well, it increased in she got thrown in jail. And they took all of our things, and the dog was in the pound, and it cost us money. It cost a lot of worry. And we still haven't got the things out of the jail, out of the impound. It's just more pressure on an already existing constant awareness of the police around. I mean, it's gotten to the point where I developed a kind of phobia. And whenever there's a cop, we're like, okay, walk normal. We're not doing anything illegal. We don't have drugs, but you just know that at any moment they could stop and say, you're camping here. We're going to take you in. I mean. That doesn't happen when you're walking usually, but as soon as you stop, that could happen, and that has happened. So we're always aware of that, and it's on the back of your mind because it happens so often. But it wears on you. It does.
So, Dennis, I haven't seen the film. Did you capture some of those moments, or was that a little bit tricky to sort of?
Well, we captured a really good interaction on the first day when Tony was waking up. We go to 7-Eleven, he gets coffee, he's packing up his things, and then the police come.
Yeah.
And this was the first day I was filming. Tony was wearing a microphone, so we actually got good audio.
Oh, wow.
Had a nice narrow depth of focus on the lens, so it looked beautiful. And I was like, I've got to do something with this footage. And I asked a filmmaker, Pablo, who works at at MOPA, Museum of Photographic Arts. And he said, just keep following Tony's life and see where this goes. So.
And see, that's an example also. See, our tent was down when the police were there. They gave us they gave us a ticket for camping there, but our things were down, and supposedly from 9 to 5:30, you can't camp. Well, we were packing our things up. They were down, but who knows? I don't know why they do what they do. But.
Right. So I'd love for both of you to answer this next question. Tony, you can go first. The mayor's really stepped up on the homeless initiatives lately. He's expanded safe parking space for people in cars. He's opened a sanctioned tent city, and he's talking about the 3 large temporary tents. What do you think about these things?
I have mixed feelings about that. The business owners and tourists, they don't want to see us on the street. I don't want to be on the street to be seen. So I understand it from that point of view. Get us off the street. I would be more than happy to go to a tent that wasn't like the little tents they have at the end of B Street. Those are, confined. You can't leave only certain times. But the big tent, now that was a different story. The people had freedom of movement there. You stay there, but you can go and come as long as you want, or many times as you want.
Right.
So the big tents, that's okay with me. They cost a lot of money to erect. Personally, I would use a stadium. There's no cost. The city owns the land. Why not just let people put their tents there?
You're talking about the former Qualcomm Stadium?
Yes, ma'am.
Okay.
Yeah. And that's what I would do. I mean, it would be a lot less expensive as a temporary fix, and that's my other concern. Getting the homeless out of the view of regular citizens. The regular citizens might think, we don't have a homeless problem. There's no homeless on our streets, but we're just locked away. The problem still exists. The focus really has to be on long-term housing and supportive network to help them solve the issues that made them homeless to begin with.
Dennis, did you want to add your thoughts?
No, I there's a lot of talk about the tents and different things, and I try not to spend much energy talking or thinking about those because there's they're kind of a response to a public health crisis, and there's a lot of
the Hepe
yeah,
outbreak.
and there's some good, especially in like the parking lots that where you can park, and Tony talking about the low cost place where you can put tents and at the Qualcomm Stadium. But I do want to say one thing, because I try not to think about it, but this always comes to my mind, is that I was reading an old article either in the UT or the Voice or something that said that the cost of the tents was X amount, and so many people and so many days, and I did the math and it came out to $17 a day. So this doesn't really sound like a lot of money, and a lot of people hear that number and they're like, not so much. Well, the money that we get from HUD, the Department of Housing and Urban Development, each year for homeless services is $18 million. So if you do the math, you take that 17, you multiply it by 365, you multiply it by 3,000 people, you got $18 million, and your budget's blown. So,
right.
So, what we've really found, actually, when a lot of this talk about an intake center and the shelter tents was happening early on, probably 5-6 months ago, I called Tao Costas, who runs Search Homeless Services in Houston, Texas, and I said, hey, it was great meeting you when we were in Houston. There's this proposal for an intake center. There's a proposal for some tents. What do you think of that? And I was like, what'd you guys do in Houston? She's like, well, we didn't build any more shelters. We didn't build an intake center. We had a spot where people could be assessed, and there's a natural point of contact at this day center. So we don't need something new that spent a lot of money on that. We didn't need more shelters because we knew that those weren't permanent, and we wanted to really focus all our efforts and our resources, every single resource of this limited amount of money on the long-term solutions to really help people in the way they need to be helped. And so that's what we did. And so I, just looking at what they've done versus kind of a lot of political energy and a lot of energy from the nonprofits and the business community focused on something that's really not a long-term solution. There is the issue of Hep A, and what I probably would have preferred is, hey, let's provide cleanliness, let's provide showers and hand washing stations and all that in the places where people currently are, and then let's take all that money and political energy we're spending on tents and other short-term things and just do really aggressive rapid rehousing dollars. You can house a lot of people quickly with that.
So for those who don't know, Houston is a city where they saw a 75% drop in street homelessness over a 5-year period, which is pretty incredible. That's why your documentary includes a lot of interviews with leaders in Houston. Are there any other lessons learned?
Well, I think a big thing that comes up with Houston initially every time I mention it is Houston's different. That's the lowest cost of housing anywhere in the country and lowest cost of living. But if you think about it, back in 2010, even with that low cost of housing, Houston had a huge homeless population. So it's not just about housing. It's about aligning all your service providers. They had, a bunch of service providers in Houston that were cycling people through shelters and through programs that weren't effective because the person didn't yet have a permanent place to live. And they refocused all those people on getting into housing. So yes, it is different on the West Coast given our high cost of housing.
Sure.
And so one thing we did to kind of understand that better is we went up to Seattle and we talked to Mark Putnam. And they just had a regional plan created or an assessment and recommendations by the same company that's working with San Diego, Focus Strategies. And they said, and Mark said, yeah, after implementing these recommendations of Focus Strategies, we were able to house 50% more people than we were prior to implementing those recommendations with the same resources, with no additional resources. So they're really felt that that's a huge advantage that they've got, is that they're really starting to implement these things in an effective way. But they're, like most West Coast cities, fighting a tsunami of high housing costs. They have Microsoft, Boeing, and all these huge companies up there. Yeah. And, they are advocating for more housing up there as well. So, but in San Diego, we can make significant progress before we add additional housing by really implementing this strategic regional plan.
Yes, and the best principles, the best practices that they talk about were same place in Utah, in Atlanta, in Seattle, and in Houston all worked. So why wouldn't they work here? They would.
So I think just to make it clear what you're talking about, San Diego for years has funded mostly shelters and transitional housing programs meant to try to help the homeless. What has been your experience with those type of transitional programs, and why aren't they effective in your opinion?
I think what they do is just get people off the streets, but they really don't address any of the issues that cause them to be homeless. And then when the program's finished, or you leave that program for one reason or another, you're back on the street again. So it really doesn't solve the problem. There's work that needs to be done. Everybody's avoiding the work of this. Just do the work. It's like a business. It just seems to me like the homeless issue is like a business that's gone bad. It needs to be looked at and see where the waste is and what's working and what's not working, and do more of what's working and less of what's not working. That's all it is. It's pretty simple, really.
So I think there's a really interesting scene in the documentary where Tony says, we went to the STEPS program, the Salvation Army, and we actually chatted with the gentleman who had a head injury, who was in the program. He was a cook, but he didn't have the health. He wasn't in the proper health to be able to get through that program. So I think the line in the movie that you said was, they're really about employment. There are employment programs that you try to go through these programs, and there are a lot of people who aren't motivated. A lot of people on the streets are beaten down, or they have health problems, or they have alcohol problems, and they're not able to make it through those programs. Now, that's not to say that all transitional housing programs are bad. What the regional plan is going to do is it's going to rate each program on its effectiveness. So if there is a transitional housing program that is effectively moving people from the streets into housing, keep it.
Mm-hmm.
Okay. And so you guys have been talking about it a lot, but I don't know if we've used the term yet. There's been a push toward housing first, and that's in all of the cities that you mentioned that you visited. And that's basically as easy as simply getting someone into housing as quickly as possible. Yes. So rather than making a person go through an employment program or all these other programs, you simply meet that basic need of getting them into a house first. That makes sense to me.
Yeah, it does. It does to me too. Being homeless on the street, if I had a place to live, I wouldn't have to worry about my things. I wouldn't have to take them everywhere with me and have people watch them for me. I wouldn't have to worry about the police throwing me in jail and confiscating my things. Then that part would be relieved in my mind, and I would be able to focus on other things and getting my life back in order.
Right. And Dennis and Tony, what was the biggest takeaway you both had about San Diego's approach and, what we could do tomorrow? I know what you're talking about, the regional plan, and you said earlier, you don't even want to talk about these temporary Band-Aids type solutions that have really, we've seen a huge uptick because of the hepatitis A outbreak. But is there just one thing you could diagnose?
Well, the in the regional plan that's currently in existence and published on the Regional Task Force on the Homeless website, Kinsey, if you could turn to page 23.
Just for, since this is audio, Dennis brought in 2 documents. Both of them are about 300 pages long. So he's flipping through one currently.
So there are a number of steps laid out on pages 21 through 23 of the regional plan, the phase 1 of the regional plan, that we are currently working on as a region. I have asked for updates. I haven't gotten them, but I'm hoping that more people in the general public will go to their elected officials and to the Regional Task Force on the Homeless Board meeting, which is the 3rd Thursday of every month at 3 p.m. in the County Administration Building at 1600 Pacific Highway, room 302. Come to that meeting and say, hey, we're familiar with the regional plan. We see that there are action items that are being worked on and need to advance, and we want to know the status of those. The general public needs to demand those answers. And by asking those questions of, say you're in an area where your city council representative or your county supervisor isn't Ron Roberts or Chris Ward, because those are the 2 people who are they're the chair and co-chair of the Regional Task Force on the Homeless Board. If your representative is not one of those 2 people, they may not be familiar with this plan, or they may not be familiar with the status of these action items. But the more you ask, the more you go to them, they're going to find out answers. They're going to want to find out, and they're going to get involved, and they're going to better understand this.
Yeah, so you have been out and about in the community doing lots of screenings and panel discussions. You have some coming up this weekend, I believe. So tell me when and where those are happening. And Tony, what has that been like for you to be out in the community in the spotlight?
Oh boy, I'm not used to it. I'm shy by nature, so it's really outside of myself doing this. You wouldn't think so watching the film, but it's true. I'm really shy. But I just feel like it's not about me. It's about the problem we have here with the homeless, and the system is broke. It doesn't work. And we're just trying to enlighten people to that and find ways to fix it, which is the regional plan, and support it.
Yeah, it's really been fascinating as we've been filming this documentary over the past year to see the changes that have happened. When we first started meeting up back in November last year, we were looking at what was going on, and there wasn't a lot going on. You know, there wasn't a regional plan. It wasn't even in the process. There wasn't the regional task force on the homeless. They just did the point in time count back then. They didn't have. They weren't affiliated with this board that has Ron Roberts and Chris Ward on it. So since then, we've seen the regional task force has been immensely strengthened. They have a board which has top level elected officials on it. They have a staff of over 20 people now. Before they were about 10 people. They have a new executive director, Gordon Walker, who did amazing things in Utah, reducing chronic homelessness, and came to San Diego to really. He came out of retirement to do this, and he actually just last week hired a woman who was the director of strategy for homelessness in the city of Seattle, and she's down here to be the chief operating officer. And then there's also a lot of talk of a bond measure. I know that Michael McConnell and Steve Russell are very involved in this. Michael McConnell is a homeless advocate in San Diego. He's been involved in this for over 7 years and is extremely knowledgeable on all these issues. Steve Russell runs the San Diego Housing Federation. And they're talking to a lot of the people who, probably. I know there's a big separation between a citizens initiative and something that's sponsored by the government now, so I'm not sure who they're talking to, but I think
there may be multiple measures on the ballot next year in terms of getting more money for ending homelessness.
And I think when the general public sees something on the ballot, what they need to do is say, does this thing that's on the ballot fully fund and fully support the regional plan? Because there could be, a low-income housing bond on the ballot that funds a lot of low-income housing, but not the kind that solves homelessness, not the permanent supportive housing. So you need sufficient permanent supportive housing to really reduce homelessness. And then, so in LA, they did a quarter-cent sales tax, which is going to fund a lot of the services that go around that. So we need, new housing and the funding for the services.
Right.
So.
And a lot of people care about this in San Diego. I was amazed. Gordon Walker, he mentioned, came out of retirement to help. And Denise Parker, the former mayor of Houston, wrote an article in detail of what we should do here.
So it's called the San Diego Community Plan to End Homelessness. Can people just Google that and they'll find a link to the document? They can print it out or read it online? Or how easy is it to familiarize themselves with this plan?
Well, there's definitely a link to it somewhere on the Regional Task Force on the Homeless website, rtfhsd.org. I'm not exactly sure where that link is, but there's also a link on my website, tony-themovie.com, tony-themovie.com. Click on what can I do, and right there at the bottom of point 1, it has a link to this plan. There's also all of the raw footage from every interview we did anywhere is on the website. So if you want to see the full interview with Mark Putnam from Seattle and see how 40 minutes of how Seattle addressed this and their thoughts on it, you can watch it there. If you want to see the interview that Tony Rodriguez did in Houston with Denise Parker, you can watch it there. Yeah. If you want to see an interview with Megan from Focus Strategies, who's actually the consulting company working on this plan, you can see that. If you want to see an interview with Gordon Walker, Chris Ward, Ron Roberts, we got everybody.
Yeah.
So you think if people dig in and they watch these interviews, they watch, maybe start by watching the film and then dig deeper, that the end result will be them being as obsessed with the regional plan as you are? I mean, because these other cities, what you learned was that it took a regional approach. It took a plan that was based on best practices and that you actually started implementing right away, right? I mean, these are the big takeaways.
Yeah, well, what I've found is that, it's hard to take somebody down the same path that I went down because they weren't actually there. So I think the best substitute for that is video. Video is just so powerful. I can tell somebody about a conversation I had with somebody in Houston, and they're like, yeah, well, or, I can write something, big email to them and say, this is what happened. And they're, I show them a video, and generally they're like, oh. But, the best thing is if they're, actually they go through the same experience. But I think people, if they do go through this, they will see that the regional plan, it's shorthand for a lot of detail. And the reason I reference the regional plan so much is because it gets really boring for the general public to hear about, the details of a diversion program or a moving on program or rapid rehousing or, permanent supportive housing or. There's a subject matter expert. There's somebody at some organization or a lot of people at different organizations who have spent their career or years studying diversion programs and really understand it in depth and can tell you more about them and how they work effectively than anyone. And that's what the regional plan is going to contain. It's going to contain in-depth detail about these and ways that we can effectively implement these things in San Diego.
So the next big screening is when and where?
So we've got North Park at the observatory. That's where Snoop Dogg played.
No big deal.
No big deal, yeah. 11:30 a.m. at the observatory in North Park. That's the North Park Theater. It's the same building. On Saturday, October 28th. Then on Sunday evening, we're going to be in Barrio Logan at Bread and Salt at 6 p.m. David Alvarez is going to be our guest speaker there, as well as Michael McConnell. And then on Monday evening, we're going to be in La Mesa at the First Presbyterian Church.
Right.
Colin Parent helped me organize that, and the folks at the church are really putting that together. I think that's going to be a fun showing.
All right. Well, thank you so much for talking with me today.
Thank you.
Thank you.
Thanks for listening to this bonus episode of the Voice of San Diego podcast. The Voice of San Diego podcast is part of the Voice of San Diego podcast network. Visit voiceofsandiego.org/podcast to learn more about our award-winning arts and education podcast, CultureCast and Good Schools for All, the Cura Chaos podcast about movers and shakers on both sides of the border, Beer Talk Radio, our business shows, Startup Vault, and I Made It in San Diego, and the rest of the shows in the network. If you like the show, go to voiceofsandiego.org and click the donate button. Or if you'd like to sponsor it, contact me at kinsee@vosd.org or by calling 619-550-5668.